Hi and welcome to Wristtraining. In between the exercises I'm going to read something about pulmonary fibrosis and try to learn it. Participating in the exercises is at your own risk, and pulmonary fibrosis is a severe disease, and I'm going to talk the whole time about symptoms of this severe disease and how it is. Now to the first exercise. So we are having a good stand and both arms with hands palm to fist next to us, and we're bringing these hands palm to fist down and up again. And if you feel at any point during the exercises pain at the wrists, then stop immediately. So we're going down as far as we can bring one down and up again. We're going always only as far as we can go with a little bit of effort. And we absolutely don't work until exhaustion. We're doing this exercise just a few times. So now for the last time. Down and again up. And now to pulmonary fibrosis. Pulmonary fibrosis affects the lungs. It's pulmonary. So the lungs are affected from pulmonary fibrosis. Pulmonary fibrosis shows the symptoms of shortness of breath, dry coughing, tired feeling, loss of weight, nail clubbing. The distal phalanges are thickened. So symptoms: shortness of breath, it doesn't have so much volume, dry coughing, tired feeling, nail clubbing, loss of weight and tired feeling. So tired feeling, loss of weight, nail clubbing. The distal phalanges are affected, so they are affected by nail clubbing. Now the next exercise, again, hands palm to fist, and now we're bringing this fist to the inside and to the outside. And we're going only as far as we can go with a little bit of effort. And as soon as we've reached the point which we could reach with a little bit of effort, turning around and then going into the out range. And for last time. So the pulmonary fibrosis, the lungs are affected, and the symptoms are tired feeling, loss of weight, dry coughing, shortness of breath, and nail clubbing. Causes of pulmonary fibrosis are certain medications, connective tissue diseases, infections, interstitial lung diseases, but mostly the pulmonary fibrosis is idiopathic, and idiopathic means that the cause is unknown. So in most cases of pulmonary fibrosis, which expresses itself through shortness of breath, tired feeling, loss of weight, nail clubbing, and I think there was one more, dry coughing, and which affects the lungs, is mostly the cause, not something like medications or connective tissue diseases or infections or interstitial lung diseases. Interstitial lung diseases, but it's idiopathic, so idiopathic means we don't know what it is. It's idiopathic. Next exercise, now flat hands next to us. We're bringing these flat hands to the inside and to the outside. And all these movements only as far as we can go with a little bit of effort. And for last time to the outside, back to the inside, and back to pulmonary fibrosis. Mostly the pulmonary fibrosis is idiopathic. Treatment options are limited. No cure exists. So there are not very much treatment options and no cure. So treatment is just to treat it, but it exists still, and the cure would heal it. No cure exists, so it can't be healed. There are some options to treat it, but the options are limited. Some are oxygen therapy and pulmonary rehabilitation. Oxygen therapy, there is oxygen-rich air breathed in, and pulmonary rehabilitation, but here's an explanation what it all is. So oxygen therapy and pulmonary rehabilitation may lessen the symptoms. Medications may slow the scarring. So the pulmonary fibrosis has something to do with scar tissue building up in the lungs. More and more. And lung transplantations may also be a choice, but there's no heal. So 5 million people are affected in the world, and the life expectancy is less than 5 years. So 5 million people have it in the world, and the life expectancy of them is less than 5 years. The next exercise is pancake flip. We have the flat hands next to us, And we bring these flat hands up to the sky and back to the ground. And we're doing this all carefully and cautious. And we're going only as far as we can go with a little bit of effort. And as soon as we've reached that point which we could reach with a little bit of effort, turning around and going into the other direction. And for the last time, up and down. So pulmonary fibrosis affects the lungs. And it's idiopathic. We don't know where it comes from. In most cases, it can be medication, connective tissue diseases, or interstitial lung diseases, or infections, but we don't know in most cases. It's idiopathic. And the symptoms are shortness of breath, dry coughing, tired feeling, tiredness or whatever, and loss of weight, and distal phalanges thickness, so nail clubbing. So distal phalanges are these. So here's the carpal bones inside of the hand, and then here are the metacarpal bones, and here are the proximal phalanges and the intermediate phalanges and distal phalanges. So there are 8 metacarpal bones: the trapezium, the scaphoid, the trapezoid, the capitate, the lunate, the triquetrum, the pisiformis, and the hamate. And then are here the 5 metacarpal bones, all for one, the 5th one. Then there are here the 5 proximal phalanges, so proximal, very close to the body, proximal phalanges, and the 4 intermediate phalanges. Only these four whole fingers have intermediate phalanges, and the 5 distal phalanges. And these 5 distal phalanges, the last distal part of the fingers, that is thickened by nail clubbing. So back here. By pulmonary fibrosis, the normal lung tissue is gradually replaced with fibrotic tissue. This scar-like fibrotic tissue worsens the function of the lungs. So normally there is something called, something mentioned here, the normal tissue in the lungs. And by pulmonary fibrosis, this normal tissue is replaced with fibrotic scar tissue. And that worsens how the lungs function. The next exercise, we're having both hands out, flat hands, and we're bringing these flat hands down, and again up, and again down, and up. And the last time, down, and up. So the thing which I wanted to say to distal phalanges. So distal phalanges, distal means far away from the body, far distance away, and proximal means closer. So just as a side thing, these are the proximal phalanges, they are closer to the body, and these are the distal phalanges. And the distal part of the fingers is affected by nail clubbing. And distal means far away from the body. So everything in medicine far away from the body is distal. So the distance to it is far. So these are the most distal part of the fingers, and this distal part is affected through swallowing up and thickness by nail clubbing. And the pulmonary fibrosis, that was the last point, the normal tissue in the lungs is gradually over time replaced with a scarred fibrotic tissue, and that worsens the function of the lungs and leads to a life expectancy which is lower than 5 years. The scar-like fibrotic tissue is stiffer than normal lung tissue. So that it's stiffer, it doesn't illuminate so good. The next exercise, it is the T-Rex in the gym. So we're taking a tennis ball like this into the hand. And if you don't have one, just take this. And we are pressing with moderate force the tennis ball together. And we're releasing again. And we are pressing again. And we release. And we are pressing again. And we're switching. And we are pressing again. And release. And we are switching. But we haven't switched. We have break. And now press for the last time. So pulmonary fibrosis, it's idiopathic. Some causes might be medications, lung diseases, infections, superstitial lung diseases, infections, or connective tissue diseases. But it's idiopathic, and idiopathic means it's unknown, and proximal means closer to the body, and distal means further away from the body. So the normal tissue is replaced by fibrotic tissue, scar-like fibrotic tissue, and the fibrotic tissue is stiffer than normal lung tissue, and that robs the lungs of a voluminal capacity. That is why pulmonary fibrosis is a so-called restrictive lung disease. So the lungs don't have so much volume anymore. So they are losing, that's shortness of breath when it happens, and they can't volume support anymore. And that is why it's called pulmonary fibrosis is a restrictive lung disease. Restrictive lung disease is a disease where the volume of the lungs is narrowed. It's little. The next exercise, it is, I don't have a name for it, but we're having both hands next to us, and we're bringing the hands down, we're spreading the fingers. We're holding it for a little moment, and now we're bringing them up. We're making a fist, and we're bringing them into extension, so we're bringing them up, and we're pressing the fists also together. So press the fists together, not opening much, but press with moderate force together. And now we're opening again, we're bringing them down, into flexion the hands, and we are opening all the fingers, and we're switching again. We're making fists again, and we're bringing them up, and we are pressing the fists a little together and bringing the fists up. And the last time, we're going down, and we are into flexion, so the hands down, and we are flaring, we are spreading the fingers. And now we're coming up again into extension and into contraction of the hands, so we're flexing the fist and releasing and shaking, and we are done. Now to the triangular castle architect. Both hands were fists out and the fists together. And up, we went through with all to the pulmonary fibrosis, which was a bit there. To the outside. Down. And the last position to the inside. The whole thing. The other way around. Down. And to the outside. And up. And to the inside. And the last exercise. The next to us, we are having the hand formed to a fist, and the fist goes down, and we're pressing the fingers against the index finger. So with moderate force, carefully, with moderate force, are we pressing against the hand. Now we are pulling carefully with moderate force at the hand. And we're pressing the top on the third metatarsal bone. And we are pressing a bit upwards, basically at the third intermediate phalange of the knuckle, between the third proximal phalangeal and the intermediate phalange. Other hand, fist and down, and we're pressing carefully with moderate force from the outside against the index finger. And we are switching to the other side. And we're pressing from the top. And from the bottom. As with that, we are done with all the exercises. A little relaxation exercise for the extensor digital muscle. You have your arm long and straight. Then you make a little bend in the elbow. This is the brachioradialis. And you press with the fingers next to it into the muscle. And we're going with moderate pressure over the middle part of the lower arm. And that is the place where the extensor digital muscle lies. And by the way, we're hoping to relax it a little, because we've used it just quite a lot. So straight arm, a little bend with the brachioradialis, and we are going down with moderate pressure. So, pulmonary fibrosis. By pulmonary fibrosis, the normal tissue of the lungs is gradually, over time, replaced with scar-like fibrotic tissue. And with scar-like fibrotic tissue is stiffer, it doesn't expand so good, and through that the lung volume is smaller, and that's why pulmonary fibrosis is a restrictive lung disease, and that causes shortness of breath, dry coughing, nail clubbing, tired feeling, and loss of weight. And the causes can be medications or superstitial lung diseases, infections, or connective tissue diseases, but it's in most cases idiopathic. Idiopathic means it is unknown where it comes from. Proximal means closer to the body, and distal has a far distance, it's far away from the body. And yes, 5 million people have it in the world. Life expectancy is lesser than 5 years. There's no cure. The treatments are, for example, the lung transplantation or oxygen therapy or pulmonary rehabilitation. I thank you very much. This is the end, and until next time.